In this video, we are going to talk about the drugs to treat urologic disorders in men. The disorders that we'll talk about is benign prostatic hyperplasia and erectile dysfunction. So let's get started. So first we'll talk about BPH. BPH is a non-malignant enlargement of the prostate. It's a common condition in men as they age, and when this enlargement of the prostate takes place, there is development of some lower urinary tract symptoms. Prostate is a walnut-sized gland of the male reproductive system. It is present below the bladder in front of the rectum, and the urethra runs through the center of the prostate. Its function is to produce the fluid which forms the part of the semen. It also is involved in closing of the urethra up to the bladder during ejaculation. It is also involved in closing of the seminal ducts during urination. So it has multiple functions. First class of drugs that is used to treat BPH is alpha-1 adrenergic antagonist. Main points that you must remember is that alpha-1A receptors are present in the prostate, alpha-1B receptors are present in prostate and vasculature, alpha-1D receptors are present in vasculature. The drugs that are used include terazosin, doxazosin, tamsulosin, alfazosin, celadosin. These drugs are alpha-1 selective competitive blockers. Mechanism of action. These drugs block alpha-1A and alpha-1B receptors in the prostate. This blocking of the receptors causes the prostatic smooth muscle relaxation, which results in the improved urine flow. Pharmacokinetics and side effects. These drugs are well absorbed after oral administration. When these drugs are taken with food, the absorption of these drugs is increased, so it's best to take these medicines with meals. The half-life is ranging from 8 to 22 hours for these drugs. And the main side effects of alpha blockers include orthostasis, headache, and nasal congestion. So next class of drugs to treat BPH is 5-alpha reductase inhibitors. So 5-alpha reductase is an enzyme that is responsible for conversion of testosterone to more active dihydrotestosterone. This dihydrotestosterone is an androgen that stimulates the growth of prostate. So by reducing this DHT, the prostate shrinks and there's improvement in the urine flow. So the drugs finasteride and dutasteride are inhibitors of this 5-alpha reductase enzyme. Pharmacokinetics and side effects. The absorption of these drugs are not affected by the food. These drugs are highly protein bound, and these drugs are metabolized by the cytochrome P450 system. The main side effects are sexual side effects, including erectile dysfunction, gynecomastia, and oligospermia. Next class of drug for the treatment of BPH is phosphodiesterase 5 inhibitors. Tadalafil is the only phosphodiesterase 5 inhibitors approved for the treatment of BPH. Phosphodiesterase 5 is present in the prostate and bladder, and the inhibition of this by tadalafil allows for vasodilation and relaxation of the smooth muscle of the prostate and bladder, hence improving the symptoms of BPH. The next urologic disorder in men is erectile dysfunction. Erectile dysfunction is the inability to maintain penile erection for successful performance of the sexual activity. First category of drugs to treat erectile dysfunction includes phosphodiesterase 5 inhibitors. It's the first-line therapy for the treatment, and this includes the drugs sildenafil, tadalafil, vardenafil. The mechanism of action of these drugs. So what happens in sexual stimulation? There is smooth muscle relaxation of the corpus cavernosum, increasing the inflow of blood. The mediator of this response is nitric oxide. Nitric oxide activates guanylyl cyclase, which forms cyclic guanosine monophosphate from guanosine triphosphate. Cyclic guanosine monophosphate produces smooth muscle relaxation through a reduction in the intracellular calcium concentration. So phosphodiesterase 5 enzyme is responsible for the degradation of cyclic guanosine monophosphate in the corpus cavernosum. So the action of these drugs, phosphodiesterase 5 inhibitors, is to increase the flow of blood in the corpus cavernosum at any given level of sexual stimulation. So at recommended doses, these drugs have no effect in the absence of sexual stimulation. Pharmacokinetics and side effects. Drugs including sildenafil and vardenafil have similar pharmacokinetic properties. These drugs are taken approximately 1 hour prior to the anticipated sexual activity, with erectile enhancement observed for up to 4 hours after administration. The administration of these drugs must be timed appropriately with regards to the anticipated sexual activity. The absorption of these drugs is delayed by the consumption of high-fat meal. However, The tadalafil is not clinically influenced by food. Tadalafil has a slower onset of action than sildenafil and vardenafil and a longer half-life of approximately 18 hours. This drug results in enhanced erectile function for up to 36 hours. The timing of sexual activity is also less critical for tadalafil because of its prolonged duration of action. These drugs are metabolized by cytochrome P453A4. Adjustments of dose is recommended in patients with hepatic dysfunction, and the patients with severe renal dysfunction, the doses of sildenafil and tadalafil should be reduced. Main side effects of these drugs include headache, flushing, dyspepsia, and nasal congestion. Next drug to treat erectile dysfunction is alprostadil. Alprostadil is a synthetic prostaglandin E1. In penile tissue, prostaglandin E1 allows for the relaxation of smooth muscles in corpus cavernosum. This drug is available as intraurethral suppository and injectable formulation, and this drug acts locally. Although phosphodiesterase 5 inhibitors is the first line treatment for erectile dysfunction, alprostadil can be used for patients who are not candidates for oral therapy. Mechanism of action of alprostadil. Alprostadil increases the concentration of cyclic AMP within the cavernosal tissue. As a result, protein kinase is activated, allowing trabecular smooth muscle relaxation and dilation of cavernosal arteries. Increased blood flow to the erection chamber compresses venous outflow so that the blood is entrapped and the erection may occur. Pharmacokinetics and side effects of alprostadil. Alprostadil has a minimal systemic absorption. When given via urethral suppository, the onset of action is 5 to 10 minutes, and when it's given via injection formulation, the onset of action is 2 to 25 minutes. The systemic side effects are rare. Locally, alprostadil may cause penile pain, urethral pain, and testicular pain. So that's it. Thanks for watching. If you like the video, don't forget to like, share, and subscribe PharmCept. Thank you.